Picture a waiting room. Someone coughed, then they left. An hour and a half later, you walk in. Nobody's there. You touch nothing. You talk to no one. But the virus is still in the air. That's measles. The CDC says it can survive, airborne, for up to 2 hours after an infected person leaves a room. 2 hours. And right now, in 2026, measles is back in America. Not just back, it's exploding. I researched what scientists are actually finding, and what I found genuinely shocked me. Stay with me. As of May 28, 2026, the CDC has confirmed 1,983 measles cases in the United States, 40 states, 30 new outbreaks this year alone. And here's something most people don't realize. This isn't just a kid's disease anymore. A quarter to a third of all cases in 2026 are adults over 20. Johns Hopkins researchers confirm this. Adults getting measles in 2026. And the CDC has already warned more cases are coming. Summer travel season is here. But the raw numbers aren't actually the scary part. What scientists discovered about what measles does to your body, that's what we need to talk about. To understand why this matters so much, I need to give you a quick history lesson. In 1963, the measles vaccine was introduced. Before that, 3 to 4 million Americans caught measles every single year. Hundreds of thousands were hospitalized. Hundreds died. Then the vaccine changed everything. By 2000, the United States officially declared measles eliminated. Eliminated, gone, done. We beat it. That was 25 years ago. In 2025, we had the worst measles year since 1991, and 2026 is already on pace to be worse. What happened? I'll tell you exactly. But first, I need to tell you about something scientists discovered that changes how we think about measles entirely, something that wasn't in the headlines. Here's what I wasn't expecting to find when I started researching this. Most people think of measles as a rash, a fever, a week in bed, you recover, it's over. That's what I thought too. But scientists have discovered something that changes that picture completely. Measles doesn't just infect your respiratory system, it attacks your immune system itself. Specifically, it targets your immune memory. The cells that remember every virus and bacteria your body has ever fought, every infection you survived, every vaccine you ever got. Measles finds those memory cells and destroys them. Scientists call it immune amnesia, and the research, published in Science Journal, found that measles can erase up to 73% of your immune system's memory. Let that sink in for a moment. A disease you survive can leave your immune system in the state of a newborn baby, and that vulnerability can last for up to 5 years. Let me explain how this actually works. Your immune system has what you might call a filing cabinet. Every time you fight off a disease, flu, chickenpox, COVID, whatever, your immune system creates memory cells. B cells and T cells. These cells remember the enemy. So next time that pathogen shows up, your body is ready. Instantly. That's how vaccines work too, by the way. They train your immune system to recognize a threat before it ever appears. Now, measles virus doesn't just sit in your lungs. It goes hunting for those memory cells. It infects them. It destroys them. And when they're gone, your filing cabinet is empty. All that accumulated immunity from years of vaccines, years of surviving infections, gone. Nearly every unvaccinated child who gets measles can be impacted, said Patricia Stinchfield from the National Foundation for Infectious Diseases. Not some children, nearly every child. And here's what this means in real life. A kid survives measles, recovers fully, feels fine. 3 months later, catches a regular cold, but their immune system can't fight it properly anymore. Hospitalized. This is what researchers found when they looked at measles-affected communities. For 2 to 5 years after measles, those communities had dramatically higher rates of other infectious diseases. It's not a coincidence, but this gets even stranger because immune amnesia affects adults differently. I know what some of you are thinking. Okay, but COVID was way worse, right? Let me show you something. COVID has an R0, that's the number of people one infected person spreads it to, of about 2 to 5. Measles, R0 of 12 to 18. If one person with measles walks into a room of unvaccinated people, 90% of them will get infected. 90%. COVID at its worst was about 30%. Now, COVID's death rate was roughly 1%. Measles kills 1 to 3 children per 1,000. Lower, yes. But here's the difference. COVID doesn't erase your immune system afterward. Measles does. And then there's the brain. 1 in 1,000 measles cases causes encephalitis, dangerous swelling of the brain. But there's also something called SSPE, subacute sclerosing panencephalitis. It's a brain infection that can develop months, sometimes years after measles. It's progressive, and it's almost always fatal. A child gets measles, seems fine. Then a year later, starts having seizures. I know, it sounds like a horror movie, but it's real, and it happens. And here's the part most news articles are skipping over entirely. This is the part I want you to really pay attention to, because if you're watching this, you're probably an adult. And adults have a complicated relationship with measles immunity. Here's how it breaks down. If you were born before 1957, you almost certainly had measles as a child. Natural infection, full immunity, you're likely protected. If you were born after 1989, you probably got 2 doses of MMR vaccine in childhood. You're almost certainly protected. But if you were born between 1957 and 1989, you might have gotten only 1 dose, because before 1989, the CDC only recommended 1 dose, and 1 dose offers about 93% protection, not 97%. That gap, in an outbreak, can matter. And here's what Johns Hopkins researchers found this year. 1/4 to 1/3 of all measles cases in 2026 are in adults over 20, not children, adults, people who thought they were protected. So let me ask you a direct question. Do you know how many doses of MMR you've had? Do you know for sure? Most people don't. And that uncertainty, right now in summer 2026, is actually dangerous. Because summer travel season means airports, concerts, crowded places, and the CDC just warned that more cases are coming. So how did we get here? How did a disease we eliminated in 2000 come roaring back in 2025 and 2026? The answer is actually pretty simple. Vaccination coverage fell. During the 2019 to 2020 school year, 95.2% of American kindergartners were vaccinated against measles. By 2024 to 2025, that number had dropped to 92.5%. That might sound small, but measles is uniquely unforgiving. To stop measles from spreading, you need at least 95% of the community to be immune. We slipped below that threshold, and measles noticed. The KFF Health Tracking poll this year found something striking. Almost 20% of American adults believe that getting the measles vaccine is more dangerous than catching measles itself. I'm going to say that again. 20%. 1 in 5 adults. That belief is not supported by science. The MMR vaccine has been given to billions of people over 60 years. Its safety record is extraordinary. I want to be very clear. I researched this extensively. The science on MMR is not ambiguous. But I also understand why trust has eroded. The last several years did a number on public trust in institutions. I get it. I really do. And I'm not here to lecture you. I'm here to give you the actual data and let you make your own decision. What I